All right, you've had surgery. Well, now it's time to rest. In order to fully recover and heal, you need to have as less stress as you can and rest as much as you can. So rest in bed the day you get home from having surgery, or if you're in the hospital, rest, rest, rest. Depending on which surgery you had, if it's top up, then only get up to go to the bathroom and walk around a little. If you've had genital surgery, they may have you stay in the hospital bed for a day or two and then help you walk, those sorts of things. But if you've had surgery that's on your chest, breasts, or face, you should be able to get up and walk to the bathroom and walk around a little bit. But be very gentle with yourself and let other people help you. The next few days after surgery, it's really important to take it easy. You can be up and out of bed depending on the surgery that you had, and how much will also depend on those instructions, but you should really be napping and resting frequently. For many people, pain medicine makes them sleep, and that's okay. They really want you to rest. In order to rest, this can be very challenging for people who are used to being very independent, getting up every day, doing their thing, not needing any help from anybody. It's really important that you allow your body to rest and that you lean on your support system at this time. Not everyone has a support system, but you do. So it's really important to lean on them. And this may be your parent, this may be a significant other, this may be a friend, whoever it is. It's going to be really important for y'all to have that relationship where they can look at you and be like, hey, you're overdoing it. Get back on the couch or get back in bed. You need to rest. And it'll be really important for you to be like, yeah, you're right, and follow their instructions. This can be particularly hard for folks who've been waiting for years to have surgery, and you're just overjoyed and you're so happy that something that was there is gone, or something that wasn't there is there now. And you might be so happy and excited about that, and that may give you some energy, and your pain may be very well controlled, so you don't have any pain. So you might be just like, hey, I'm good. I'm living my life. I'm going to wash my hair. I'm going to do my things, but that's not the time to do it. And so really caregivers need to be empowered to make sure that you rest. Their job is to protect your rest, and they need to rest too. So making sure maybe that they have somebody that they can call to come in and give them some breaks can be very helpful. I get this question a lot. Oh, how exactly long will recovery take? And there's no one answer to this. The length of time for healing is very individualized. It depends on your age, your health, what other things you have going on, what type of surgery you have. Medicine will be prescribed to help with the pain, and pain is usually minimal if the pain is well controlled. And some people don't need very many days worth of pain medicines. Other people, pain is much harder to control. So it'll be really important if you or your caregiver have any concerns about your pain, to be in touch with the surgeon's office to make sure that you have that very well controlled. It is important to realize that microscopically, it will take you 2 years to heal from surgery. A lot of people are very surprised by that. It's important to know that all surgical wounds heal in phases. There's an acute healing phase. That means right after surgery. That's going to be 6 to 8 weeks, where you see a lot of changes really quickly. Swelling goes down, things look better. And then there's the chronic or long-term healing phase that lasts a year or two, where things continue to evolve, but at a much slower rate. And scars themselves aren't until they're in their final form until 1.5 to 2 years after surgery. So it can take a long time for things to kind of look like they're going to look. So sometimes folks will say, oh, this is not sitting well, or this doesn't look right. But if it's been, a couple of days or a couple of weeks, that's not what it's going to eventually look like. And so sometimes it can be very difficult to be patient, but most of your surgeons will tell you, be patient, let's see how it looks over time. And if it's still not looking right, they may recommend a revision or a whole nother surgery in the future. And that can be, upsetting, but it's also the reality and part of medical treatment. So give it time. Your new post-operative body will not look like you want it to. It will not look like you would expect. You have to give it that time we talked about to reform. The appearance will continue to change for at least 4 to 6 months. They actually shut down Johns Hopkins when the original transgender surgery treatment that they had, because there was a research study that interviewed patients right after surgery, and people were not happy with how things looked. That was because they literally just had their body cut open and had surgery, and they were looking at, themselves with wounds and not with how their body's going to look when it finally heals. And they actually shut down the whole place because people were saying they regretted surgery. But the issue is, when you give people time to heal and then you ask them after that, you're not going to hear anywhere near as many people saying that they regret having surgery. And so that's why Johns Hopkins is now reopened, which is wonderful. So it's really important that you don't hyperfixate on how things look post-operatively, because they're not going to look like that over time. So now for some community advice for folks having face surgery. This is what some community members have said. You're going to look like a train wreck for a few weeks, and your jaw is going to be swollen and broad for months. Dysphoria will likely get worse before it gets better, but it will get better, and you're going to shine like a star. And then some community advice about general surgery. At least half of the people who have the surgery will experience some kind of complication. Things like wound dehiscence, which is where the wound is, instead of sticking to itself like it's supposed to, will kind of come apart. That's common. It can be managed. There's a lot of nerves down there, and it will be painful. Healing is slow, but the body is amazing, and you will heal. You deserve to have the junk you want, and you're a total boss for going out and getting it. I love our community. For those getting a vagina, find a very good pelvic floor physical therapist that can help you to understand your anatomy, your muscles in the pelvic floor, that can help you relax enough to dilate and to make dilation an easier process, because some people really struggle with dilation. So making sure you have a good pelvic floor physical therapist, especially if you want to keep the vagina that you just got. Why is that? We'll talk about dilation in a little bit. But one of the ways the body tries to heal itself is with the new vagina is by trying to, stick to itself and close it up. And so in order for it not to close on itself, you have to dilate, and you have to do that regularly. That can be challenging, but finding a really good pelvic floor physical therapist will be key. And many surgeons will have a couple at least to recommend to you. Also, if you're getting a graft on your arm, or your hands or arm are being used in surgery somehow, finding a physical therapist who works specifically on hands can be helpful in order to help you regain use of your hand quicker and better in the long run. So physical therapy, totally important for folks who are getting a vagina or for using their hands or their arm as part of the graft.